Policy is about politics and power. If I were to send you off to read about influencing policy from standard texts on public policy, you would soon form the opinion that policy processes are very rational, very straightforward, and very boring. The reality is quite different. Policy is about politics, and it's therefore about power. If we as social workers are interested in influencing policy, then we need to understand government and understand how power is manifest both inside government and outside government. In this way, we can begin to appreciate that influencing policy is essentially about engaging in the politics of power as they are manifest in government and in the circles and networks engaging with government. It is this central realisation that policy processes are really exercises in power, which suggests that policy and policy practice is far from dull. In reality, and for social work, it is in effect the main game. It's very hard to underestimate this, as it is also hard to get workers engaged in the street level of policy implementation to appreciate this core fact. It is where ultimately all of the decisions are made which determine the context of everyday practice. Over the years, political science has developed a range of theories for understanding both who has power and how it is exercised, or put another way, who makes the decisions and how these decisions are made. In fact, this issue, how decisions are made, not only at the macro policy level, but also at the organisational level, has long consumed the minds and thoughts of social scientists everywhere. We can define the range of contributions and attempts to come to an understanding about power and decision-making as theories of the state. How we do what we do, the organisational sites, the interventions we deploy, are all shaped by the policy framework which surrounds it. The decisions by government about how to allocate resources, what social experiences are constituted by governments as social problems in need of a policy response, or where that response is located, i.e. in the state, the market, the non-profit sphere, or the informal sphere of the family, are all policy decisions. Furthermore, the impact on citizens of the answers to these questions is profound. We'll come back to some of the actual theories a little later. First, I want to illustrate this point about the impact of context, to illustrate that decision-making of policy level affects what we do as social workers, and that this has a profound impact on citizens and the people that we see as clients. Let's take oral health as our example. Incidentally, the 20th of March is World Oral Health Day, the same day every year. Launched in 2007 by the World Dental Federation, the day is dedicated to raising global awareness about the prevention of oral diseases. As I'm sure you are aware, dental health care is largely excluded from Medicare. Clearly, this has significant implications for low-income and disadvantaged households who have comparatively less capacity to pay for dental health services. This is not a new or recent issue. Much research has been done to show the extent of poor oral health and the impacts on people with oral health conditions. For example, research by the Brotherhood of St Lawrence in 2011 included reference to a study by the Australian Institute of Health and Welfare that found more than 50% of 6-year-olds suffer tooth decay. More recent data from the Australian Dental Association Victorian branch shows waiting times in Victoria continue to increase. According to a May 2022 report, there are more than 1.5 million Victorian adults eligible for public dental care who are now forced to wait on average 24.8 months to receive an appointment for basic dental care, an increase of 2.1 months since June 2021. This is the longest waiting time for the past 10 years. The impact on people has been significant. So let's put a human face to these issues. Now, Barry could easily be someone you might encounter in your social work practice. He could also have been one of the many people I interviewed for a research project into the experiences of work and welfare and how people get by on a low income. In our interviews with 150 people, it was evident that access to dental health care was one of the most prominent areas people were missing out. Unlike Barry, though, most of the people I spoke to with dental health problems, and there were many, were reluctant to smile. They would mumble while talking, or they would cover their mouths with their hands. Kylie, for example, aged 42 and living on a disability support pension, said that when she went for job interviews, her teeth made her feel so paranoid and she tried not to smile. She said there were 3 things that she would like to be able to afford. Quote, buy some nice clothing, go and get my hair done and my teeth, instead of having to be on a waiting list, to actually go into a dentist and say, right, do it, I can afford to pay it, unquote. Many of the research participants had joined long waiting lists at dental hospitals. Jason was one man who said, 2 years is a very long time when you have a toothache. Chloe spoke of her experiences of a toothache that involved a 6-month waiting list, a lot of pain, and in the end, losing the tooth. Greta had experienced long-term toothache because she could not afford the treatment, even with private health cover. And the parents we interviewed told of worrying about the state of their children's teeth and being unable to afford proper care for their children as well as for themselves. Some questions for you to consider about your assessment of Barry. What assumptions do you make about his circumstances? What assumptions do you make about the origins of his tooth decay? If you were an employer, is he someone you would employ? As a social worker, does the state of his dental health, his physical appearance, affect the nature of the work that you might do? Now I want you to try to imagine what this man might look like if he had access to free dental health care. How might you think of him differently? How might others? In what ways do you think better oral health might influence his social and economic well-being? So what's the point of this discussion? My point is to illustrate to you the ways in which the policy context and the decisions made by the state shapes the services that are available to people, that in turn affects the welfare and well-being of individuals, and importantly for us, influences the nature of social work intervention. So in this case, government decisions about oral health care have been made that have implications for people who can't afford to pay for it themselves. It has implications for people like Barry, and it has implications for us as workers in terms of the types of social problems we encounter. And it has potential implications for our relationship with clients and the assessments that we make about their circumstances and needs. So let's talk about this a little more. Australian governments have decided that oral health is best provided through the market with an increasingly residualised safety net for low-income people. Dental health is not a universal service covered under Medicare. Is this an appropriate decision for government? Who benefits from these arrangements? Who is penalised? You might like to take an opportunity just to jot down your notes. What is important for us to be mindful of is how these decisions get made and how we might make sense of them. To think about who is in the loop, who is out of the loop, and what the implications of being in or out are.